Good afternoon, everybody, and thank you for being here today. Dr. Joe Canner is with me as normal. He will be giving some updates shortly on the vaccine. But first, as all of you know, my current proclamation expires tomorrow. The new proclamation, which I have already signed, will keep the state in the same modified phase 2 that we are currently in. All of those mitigation measures, all of those restrictions remain in effect, and that certainly includes the mask mandate. This proclamation will be issued for 28 days. It will expire on February the 10th. In addition, today I am making a strong appeal to the private sector to do everything that they can to maximize the number of employees they have who can work remotely and not have to travel and go to work and work in an office building or wherever. That would be a very important thing to do right now. And that's because the state remains in a precarious place. Cases and hospitalizations are increasing in every region. You can see the statewide graph here, and as it relates to case growth in the upper right-hand corner and hospitalization increases in the lower right-hand corner. And you can see the test positivity on the left, the graph on the bottom there, where our test positivity is above 10%. In fact, it's 13.7% over the most recent week for which we have information. Louisiana is currently ranked 21st in the country for average daily cases. Today, our case report is 4,673 new cases. We're also very sadly reporting 53 new deaths today. Current count of individuals hospitalized in Louisiana with COVID-19, 2,035. That's up 53 from yesterday. 244 of those individuals are on mechanical ventilators. We have no doubt that here and elsewhere in the country, by the way, the numbers that you are seeing are a direct result of people's actions during the holiday period. The several days leading up to Christmas, that interval between Christmas and New Year's, and now obviously we're starting to see that the New Year's holiday activities itself feed into these numbers. And I guess the message is the mitigation measures really do work, but only to the extent that people follow them, employ them. Informal social gatherings and those types of things that we typically associate with holidays are the largest culprit right now. That's what's feeding these case numbers. And look, make no mistake, they're still happening in retail settings, they're still happening in restaurants, they're still happening in industrial settings and food processing settings and religious service, whatever. But the real growth that we've seen here lately, and this is one of the reasons why we can tie it with a lot of confidence back to the holidays, are these informal social gatherings. Whether it was a party at somebody's house or just people coming over to visit, to exchange presents, and that was done like it had been done in years past, and people were inside without masks on, in close proximity to people who are not from their immediate household, and sometimes for very extended periods of time. And some folks, despite all of the warnings not to do this, thought that, well, if the people come into my house test negative on their way here, it must be safe. It is not safe for all the reasons that we've been discussing for a long time now. So I am imploring people that there is no doubt that the restrictions and mitigation measures that we have in place will work to arrest the case growth, lower the positivity, decrease the number of people going to our hospitals, but only if people actually adhere to them. So I'm encouraging everybody to do that because, quite frankly, we're not in a very good place, as you know. By the way, the numbers that you saw on that graph a while ago, that's every region of the state. Without exception, every region of the state has a positivity that exceeds 10%, has increasing cases and increasing hospitalizations. Just a few days ago, we reported our second highest daily death total since the beginning of the pandemic, 105. 105. For those of you who cover the legislature or are familiar with the House of Representatives chamber, every seat in that chamber, if it were filled with an individual and they all died, that would be 105. That was one day. I wonder how many of those 105 would still be with us if they had decided to turn down that invitation to the Christmas party. Or better yet, had that party not happened. Or if they hadn't visited with grandchildren, instead found some other way to communicate. I would encourage everybody to understand that the best, most sincere way to express our love and appreciation for others right now is to not engage in the behaviors that are likely to cause them to catch the virus, the disease, or to expose ourselves to it. There is light at the end of the tunnel. But right now, we're in a very dark place, as is the rest of the country. But that light is the vaccine. It is safe. It is effective. Very few significantly impacted individuals as a result of side effects from the vaccine. That's been the case here in Louisiana and elsewhere. I would remind people that it's approximately 95% effective in terms of vaccinated individuals not getting COVID, and it's right at 100% effective in preventing serious cases of COVID. That is an efficacy associated with these two vaccines that we're talking about, the Pfizer and Moderna COVID-19 vaccines, that you typically don't see in other vaccines. So I do encourage people to make sure that they are prepared to take the vaccine when it becomes available to them. I do want to tell you that, we live at a time when technology, I think we're seeing some of the ills from modern technology and social media, but there are some great aspects of it too. It allows us to be close to individuals without being physically close. It allows us to see one another and to talk to one another and so forth. It also allows us to work without having to go to the office and be in close proximity to others. So let's all, whether it's our personal life or our business life, let's try for the next month or so, and we may need to do this longer, but let's try for the next month or so to really maximize the degree to which we all take advantage of things like Zoom and FaceTime and other technologies that are out there so that we can help slow the spread. Because I want to be clear, nobody should be gathering with people outside of their immediate household unless it's necessary, period. You should always remember that outside is better than inside. Just because a venue is open doesn't mean you should go. If you want to patronize your favorite restaurant, please do that. That's very helpful. And you get a good meal in exchange. But pick it up and bring it home if you can. Have it delivered. People who are 65 and older and those with underlying health conditions that make them more vulnerable to this disease should not be spending much time outside of their homes except for doing essential things like work, picking up food, or seeking medical care. And if you can, have your groceries delivered or pick them up curbside. And those same individuals should go in no indoor space where anyone is not wearing a mask. That's been coming from the White House Coronavirus Task Force to us for many weeks now, and it's more important than ever. These are the things that I think earlier in the pandemic we were doing a better job at. We need to get back to these things, and I doubt that there are many folks out there across our state and across the country who at this point don't know someone who has had COVID, or maybe someone who has died or is in the hospital right now. That'll give you some indication of just how widespread this disease is in every community across the state of Louisiana. So it is time to buckle down. I think we can all say that collectively, and while many individuals have been extremely careful and responsible, too many have not, and we can do a better job collectively. So let's do what we know works. Let's wear our masks. Let's stay 6 feet away from those people who are not part of our immediate household. Stay home when you're sick. Wash your hands frequently. You know, we were on a phone conference, a video telephone conference earlier this afternoon with the White House Coronavirus Task Force. And one of the things that they really stressed is that while we have the vaccination underway here and across the country, too many people are losing sight of the essential things they have to do every day. And that is the mitigation that's in place, that works. Because despite everybody's best efforts, we're not all going to be vaccinated tomorrow. This is going to take some time. But in the meantime, this disease is being contracted by more and more individuals. More and more of them are going to the hospital, and more of them are dying. So the mitigation is extremely important. Shifting to updates on the vaccine, and there'll be more information from Dr. Cantor in just a moment. But it was announced today, I think earlier, but then again to us on that call with Vice President Pence, that the CDC is changing its recommendations on who gets the vaccine now, inconsistent with what came out from the Advisory Committee on Immunization Practices previously. And it was that guidance that informed our decisions about creating priority groupings for receipt of the vaccine. This happened today. We're still taking a good close look at that, and it's going to be some time before we announce any changes, if at all, to our approach with respect to priority groups. One of the reasons is we're already focused on those most vulnerable in Louisiana, those who are 70 and older, and we still have a lot of those individuals who have yet to be vaccinated, but yet who want the vaccine. So we have some time here. We're going to be taking a look at that, but we won't be making any announcements today with respect to that. Under our current plan, we've administered at least 159,690 shots of vaccine. 21,652 of those have completed their second dose and are fully vaccinated now. Now, those are minimum numbers because they come from links. There's always lag time between when shots are administered and when that data is uploaded into that system. I can tell you that as of this week, the vaccine is being administered in every parish in the state, all 64 of them. We have more than doubled the number of sites that individuals can access for their vaccines. It's safe and it's effective, no cost to the patient. This week we have 210 vaccine administration sites across the state, not counting hospitals. 180 of those are pharmacies. 20 are FQHCs and other clinics, and then we have 10 other sites like parish health units and so forth. Now, that's this week. We can't guarantee that all of those sites will be furnished with vaccine next week. In fact, we don't even yet have next week's allocation yet. That should come sometime tonight. But we will make sure that every one of these locations, if they're using a Pfizer vaccine, gets a second shot of Pfizer 21 days later, or if they're using Moderna, they get a second shot of Moderna for everybody 28 days later. And I do want to remind individuals that across the state, if you're looking for a vaccine and you're in the priority group, these 210 sites that I mentioned, they're taking appointments, and everyone who is eligible in the population of Phase 1B of Tier 1, you're eligible to make an appointment. Obviously, it's subject to limitations on the amount of vaccine that they have, but you can make an appointment even if you're not an established client or patient of that particular facility. And so those individuals that we're talking about, those are 70 and older, healthcare workers not covered in Phase 1A, dialysis patients and staff at dialysis centers, and then home care patients and staff. To date, the Department of Health has enrolled more than 1,500 providers. These are what we call enrolled providers for the Tiberius system that was created by Operation Warp Speed. These include hospitals, pharmacies, clinics, nursing homes, and other facilities, which means that the vaccine can be shipped directly to them. We can, when vaccine is allocated to us, we can order that vaccine and have it delivered directly to them, and then they can administer vaccine as well. In addition, there are another 300 or so vaccine providers who will soon complete their enrollment. So we'll have around 1,800. This is critically important to have the infrastructure in place as we continue to receive larger and larger allocations of vaccine from week to week, which we hope will be the case. And certainly that will be the case when new vaccines come online, those beyond the currently available Pfizer and Moderna vaccines, because you want to have that infrastructure in place and all those systems tested and so forth so that we can very quickly administer the vaccine in ever-increasing numbers. We're also excited to announce today a new partnership between one of our HBCUs, and it's Allied Health School, that being Xavier University, and Tulane, so that those health school individuals will receive their vaccine. And we thank Xavier and Tulane for that partnership. At this time, I'm going to turn the podium over to Dr. Cantor. He's got more updates on the vaccine. I would ask you to ask questions of him related to the vaccine as best you can. Then I'll come back up, conclude my remarks, and take your questions as well.
Thank you, Governor. Thank you for your leadership. Good afternoon, everyone. To reiterate a little bit what the Governor mentioned in terms of where we are with the pandemic, to be very blunt and very clear, it has never been as bad as it is right now. There has never been more COVID in Louisiana than there is right now. The risk of community spread and community transmission has never been higher than it is right now, and that is across all 9 regions, all 64 parishes. All of our 64 parishes are in the highest category of community transmission risk according to the CDC. Percent positivity for the state is well above 10%. Hospitalizations are above both of our previous spikes. And what is more frightening than that is looking at the numbers. We've not yet seen a suggestion that we are peaking and going down. So we know we still have some epidemiologic effect from the holidays ahead of us. We know that all the transmission that occurred over New Year's, for example, and then the subsequent second and third generation transmissions from that, of course, have not come yet. So we think the next couple of weeks are going to be very challenging. And I'll tell you, anecdotally, as a clinician, as an ER doc, and in talking to colleagues of mine, we've more and more patients that I've been seeing and that my colleagues have been seeing are under the impression that they were exposed at the informal social gatherings that the governor mentioned, parties, dinner parties, those sorts of activities. And just one of the saddest things in the world that I've seen a number of times when I work clinically, and a number of my colleagues have as well, is when a family does not really internalize the risk of this virus until it is their loved one in the ICU bed. It's really heartbreaking. And it's been happening, again, in my anecdotal experience, in increasing frequency. And so I'd ask families to think about that. Things are as bad now as they ever have been. We do anticipate that they're going to get worse. And no family wants to be in the position of coming to the realization of how serious this virus can be until it's too late. We continue day in and day out to report new fatality counts upwards of 40, sometimes as high as 60 or even 105 last week, as the governor said. That continues to be simply unacceptable as Louisianans. And I think looking ahead, look, what was done over Christmas and New Year's, to some degree, the die is cast on that. We can stop the second and third generation transmissions now, and we can set ourselves up for better results going forward. We have things to look forward to. We have NFL playoffs. We've got carnival season, and folks need to be thinking now about how to enjoy those safely. Talk a little bit about the vaccine, and I really am encouraged by the really great work that's been happening with the vaccine. So as of this morning, our administration rate is at 2,788 administrations per 100,000 residents. And I checked, the CDC maps out by states where they lied. As of this morning, last I checked, I think we were at 22nd in terms of states. So that's fairly encouraging to me. I think the state's doing a good job of moving vaccine out and getting vaccine to end users. And certainly the vaccine providers, hospitals, clinics, and pharmacies are just doing a tremendous job under not easy circumstances, because, as the governor mentioned, we don't get a lot of advanced notice of when vaccine is going to be allotted to us. So what we ask of a provider, so to say, which is a tall ask, is with very short notice to line up appointments and use that vaccine before it expires. It's not easy, and they're really doing a tremendous job. I want to thank the public for making appointments, for calling, for not going in person to a location hoping to get vaccine. You won't if you do. We have clear instructions to clinics and pharmacies that they must be doing this on an appointment basis, no walk-ups accepted. So you will not get vaccine if you just walk up to a store. I think people know that in Louisiana, and we have avoided some of the chaotic super spreader type events where people line up that some other states have had. So I want to thank people sincerely for that. Last week, we sent 10,700 doses to 107 providers. This week, we are currently sending, and these distributions are happening, most have happened yesterday and today, some will continue today and tomorrow. We're sending 35,785 doses to 210 providers, of which, of course, 103 are new from the week prior. I do want to mention, we were able to do a larger disbursement this week because we had been planning to move out some of the remaining stock at our supplier. That's not going to be available to us next week. So if the allocations that the federal government give us hold, and we think they're going to be in the same ballpark for the next few weeks, it means that not all of the 210 community providers will be able to receive vaccine next week. I do have to temper expectations on that, and that's just a simple reality of the vaccine that we are getting from the federal government. I also want to mention that the long-term care facility partnership program with Walgreens and CVS is going fairly well as of today, or as of this morning. Walgreens has administered 6,144 doses in nursing homes, and CVS has administered 6,414 doses in nursing homes. I do want to let folks know we had a little bit more vaccine loss to report, and this continues to really sadden me because every dose is so precious. We now are up to 228 dosages lost. We've taken a couple steps to address that sizable loss that I mentioned last week, and namely we've partnered with the Public Service Commission to ensure that locations that are storing vaccine in their fridges and freezers are prioritized for priority energy preservation in the event of outages. So I think that'll help us going forward. We also know as entities, they certainly hope to use all the vaccine they have available to them within the time period, and it can be short. You know, for Pfizer, for an entity that receives Pfizer vaccine, unless they're using it under ultra cold, which only the larger hospitals can do, they essentially have 4.5 or 5 days to use that vaccine until it expires. Our regional offices of public health are prepared to help shepherd that remaining doses around at the last minute if we need to ensure that no dose gets lost because it simply hits the buzzer on the time, so to say. I also want to let people know we did report our first serious adverse reaction from a vaccine, and I'm thankful to let people know that the individual is doing very well, spent 1 or 2 nights in the hospital and has been released and has recovered. It was not a horrible reaction. The individual took the vaccine and then later that night had some GI upset, felt dizzy, went into the hospital, and is now released and doing fine. We've reported that to the CDC. That's the only such report that we've made of that nature to the CDC so far. A lot of news has happened today. The other thing that the federal government has mentioned, both I believe publicly and also in the White House call that just ended prior to this press conference, is that they'll be releasing the second dose allotments that they have been securing centrally, be releasing those to the state. This presents somewhat of an interesting situation for us because I think when people hear that, they might think that we're going to get double the doses. But it's not, unfortunately. I wish that was true. People still need the second dose. The second dose is still essential. As the governor mentioned, we have no idea what type of durability and protection these vaccines provide beyond that 21 and 28-day period. So the second dose remains essential. And the challenge for us going forward is until the federal government is able to give us a more predictable cadence of vaccine deliveries, until they're able to tell us, listen, 3 or 4 weeks out from now, you will be getting this amount, we're going to have to be thoughtful about those second doses and ensure that those second doses are available for patients when their 21 or 28 days is up. I expect we'll learn more about this in the coming days, and we'll be communicative with you about that. To go over the allotments that are happening this week, for this week, we are being provided by the federal government a total of Pfizer product, 28,275, and of Moderna, 27,500, of which 18,700 gets diverted off to the long-term care partnership program, and 8,800 comes to us in the state. We were expecting to know by now what next week's allotments will be. They've not yet posted by Operation Warp Speed. We expect them to be posted later tonight. But the anticipation, or what we've been hinted, is that this should be in the same ballpark as what we've been given. Folks will recognize that's not a lot of vaccine, unfortunately. And that's the essence of the conundrum right now. We have a lot more people eager to get the vaccine and a lot more providers eager to give the vaccine than we have vaccine available to us from the feds. That's the number one challenge we face right now. And every day we hear providers, hospitals, clinics, pharmacies say, we are ready to give vaccine to a large group of people. Just supply us. And I think it's encouraging to hear that. And we're anxious to have enough vaccine to be able to do that. We are, as the governor mentioned, doing everything we can to gear up for larger volume vaccine events. We've enrolled over 1,500 vaccine providers. That's going to pay dividends when we have more vaccine available. And as the governor mentioned, we have schools of allied health like the Tulane Xavier partnership today vaccinating their residents, students, and faculty so that we will have those individuals available as vaccine providers when the time comes. A lot of people in the community and hospitals as well are doing a lot of legwork now to prepare for the larger scale, mass volume vaccine events that we are eagerly awaiting. And the limiting factor is just how much vaccine we have available to do that. But the work is being done now to prepare. So I do want to just close and remind folks, as we continue to get more granular about the vaccine, this is the most dangerous time in Louisiana. We've gone up from last week, and although it's a new year, and there's a lot of distractions and plenty of things to be thankful and excited for, the risk of community transmission is higher now than it ever has been. And folks really need to take that to heart. It is dangerous right now, and people need to be as careful as possible. Be happy to answer any questions. Yes, sir.
I'm curious about some of the statistics that were reported saying that of the vaccine that is coming to Louisiana, one report was that of 266,000, only 28% has actually made it into arms, which wouldn't do any good, really. So is that accurate, or what's the deal with that? And how do you try to correct that?
Yeah, there's some nuance in there. So grand total now we've had just over 320,000 doses allocated to Louisiana, of which 93,600 have been diverted off to the long-term care partnership. So we don't really see those until Walgreens and CVS uses those in the nursing homes, giving about 228,200 that is under our direction, so to say. Of those, 138,046. So decent number, over half have gotten administered so far, as is evident in our tracking system. And a big limiting factor is a lot of people are doing vaccines and entering it on paper at the time of service and then going back and logging it into the computer. So we don't have an accurate number to say this many shots in arms were given today until those entries in the data systems, transmitted over. So it does lag a little bit, as the governor has said. We made some big changes last week to basically set ourselves up to use as much as possible, mainly being instructing hospitals that now they have full range once they have enough vaccine available to offer to the community within the eligibility tiers, and also to move vaccine out of the storage facilities at Morrison-Dixon. So over 13,000 doses of Moderna got moved out this week, and somewhere between 3,000 and 4,000 doses of Pfizer are being moved out right now. That will essentially zero out the stores that we have at the Morrison-Dixon facility. So I think all of those are going to help that. And then the biggest thing is just we asked this of providers, if they could enter in their administrations as quickly as possible into links, we'll be able to get more timely data to you.
Is that would have changed those numbers?
Yeah, I think it was multi-factor.
Being smaller, and then it changed the way they were entering.
Yeah, I think it was a combination. I think some providers kind of caught up with their entries or came close to. Hospitals opened up to a larger circle, and then we moved some of that vaccine out into the community. So, yep, Sam.
On that same point, so one of the changes the federal government announced today was they're going to start allocating vaccine doses based on how well we're doing here, right, and using our vaccine. So to that point, are you offering incentives or any, how are you going to, incentivize these providers to upload it to links quickly? Because that's a big component here if we're going to be getting vaccine based on this. And also to clarify, you're basically saying even though the feds are releasing all the doses, you're still going to hold back half the doses right now for the second shots until we have a better stream of supply coming in?
To the second point, we need to do some more strategic planning. It might not be exactly half the doses. It might be some percentage based on what we can expect. And that percentage that we have to hold back gets less and less the more that Operation Warp Speed can tell us, okay, 3 or 4 weeks out, this is what you can expect. The more that they can guarantee us a minimum dosage, the more that we will feel comfortable getting out. What we don't want to happen is no one should not have their second dose available to them when their 21 or 28 days come up. So I don't know if it will be that many, but that's what we're going to be planning for over the next week or two. And Sam, I'm sorry, just remind me of the first part.
The feds say they're going to change
Yeah, this was announced today, and then again, there's going to be a new administration in a couple weeks, so we'll have to see, how that all changes. Our main incentive to providers is that we're communicating very clearly now that we're not going to resupply anyone that has remaining stock, and the way that we know our barometer for remaining stock is that link system. So the faster that a provider can enter into links, it will allow them to be able to receive new supply when that becomes available, and it will allow us to get timelier data on the administrations being given. Yep, sir.
Has there been any consideration to follow states like Texas and California in terms of how they're using some facilities like large stadiums to have mass vaccinations to a large group of people at once? Has there been any consideration for that?
Yeah, absolutely. And there's been a lot of planning. Communities and hospitals, I know right now, with the regional offices of public health, are planning for these large-scale vaccination events. And the limiting factor now is just how much vaccine to have. And this is the challenge. It's a zero-sum situation. And in order to supply a few communities during large-scale vaccination events, the consequence of that would be not being able to supply pharmacies and clinics. And right now we're happy that we're able to supply pharmacies and clinics in all 64 parishes, and to do so we hope would be a decent cadence. And that wouldn't be an option if we were to divert those vaccines to those type of large-scale events. That's the challenge. I think states are making different decisions on that. The decision that we have made so far is we want to make sure that people across the state have access to vaccine, and that's.
So we can expect to see the same plan that we've seen so far continue to roll out?
For the next couple of weeks, as supply lasts, and again, I really have to temper this because we moved out that stock at Morrison-Dixon, we had a larger amount of vaccine to push out this week. That's why we were able to go to 210 providers. We're not going to have that much next week because we're essentially zeroing out those stocks. So not every one of those 210 providers that's receiving this week is going to receive next week. Melinda?
Can you explain, when I look at the CDC site, it says Louisiana has had 368,000 doses of vaccine distributed. Can you explain what the discrepancy in the numbers seems to keep being? Because that keeps happening. The state's number is lower than
The discrepancy is because of the Angel doses. And the program, what happens, we were referring Angel doses as the Pfizer vials, as we found out, that you can get more than 5 doses at it, usually 6 doses. That wasn't planned for on the front end. And what providers do on the back end when they realize those extra doses is they go back into the system and enter that in as inventory. And so that's why it's essentially that CDC snapshot is showing a larger amount of vaccine than Operation Warp Speed actually allocated to us. Because they allocated to us at 5-dose vial for Pfizer, but yet people were able to get 6, sometimes even 7 doses.
But isn't that a more accurate comparison than the number of actual doses that the state ended up receiving as opposed to having allocated to it, because that's the number of doses the state has available to go into ours?
I mean, I wouldn't argue with that. I think it's just 2 different ways of counting it. Yeah. Yeah. Yes, sir.
Except that it depends on the syringe you're using to draw it out.
Because
Because they didn't marry up the syringes that don't have the dead space, is what they call it, with the Pfizer vaccine. So go ahead and explain that, because there's not 6 doses in every vial.
there's not. If you need a small gauge syringe, you need to draw it up in a particular way, and I would not. It's not a given that any provider is going to be able to do that. It just becomes challenging to marry the numbers because we have the number of doses that Operation Warp Speed sent to us, and then you have the number of doses that essentially gets entered as inventory by a provider because of those extra doses. So it makes it for a little bit. The comparison becomes confusing.
And they don't report that, the providers don't report that back to y'all, they report it straight to the CDC?
No, they report it to us in links, which then communicates on the back end to the CDC. And the numbers that I've typically been reporting to you as the weekly allocations, I'm reporting what Operation Warp Speed makes visible to us in terms of what they're sending to us. Yes, sir.
Why do you feel like people in Louisiana are more likely to provide, are like less likely to abide by the mitigation measures now than they were, say, April or even under August?
It's a great question. I don't know the answer. I can talk from my own experience. It's been a hard 10, 11 months. You know, I mean, it's been a heck of a year, and I think we all were excited about the new year. And I mean, the governor mentioned this a couple of weeks ago. It's just because it's 2021, it's not going to look different for a few more ones down the road. I think we all have a lot of fatigue, and we're ready for this thing to be done. But again, as the governor's mentioned, it's not done with us. So I think that's the essence of the challenge. I think where we need to be thoughtful and you know, our communications challenge essentially is how to continuously remind folks of the danger without doing so in a way that is repetitive or is easily ignored. And I think that is a challenge because it's been going on for so long. I think Louisianans are resilient and accustomed to responding to emergencies. This is just an emergency of duration that we're not used to. So the more that we talk about it, I think the better. The more that we can share stories of families that are affected by this virus, the better. But fatigue is real, and we need to acknowledge that head on. It's completely understandable to be fatigued. We all are. That said, we still have a ways to go, and we are more in the thick of it now than we ever have been before.
Do you also feel like maybe the vaccine news is creating like a false sense of security for people?
You know, I hope it's not. I hope it's not. I think it's certainly more things to consider. I hope it's not. And we're not going to get to a point with the vaccine where it makes a public health impact until months down the road. You know, I mean, it certainly will make an impact. You know, if a nursing home resident gets vaccinated, that makes a giant impact in their life and their family's life. It's not going to make a public health impact until down the road, and we need to be clear about that. Last question, sir, and then I'll turn it over.
Yeah, and there's a tool that has been developed since all this happened that has now been confirmed to predict the severity and the outcomes. It's the taste test tool that has been developed by a doctor here in town. And I'm wondering if there's been the consideration of using that because it provides people with a lot of information about how they genetically react to getting COVID or not COVID, how sick they would get, what they don't get, and the numbers are running close to 100% accurate if you're a taster or a non-taster.
Yeah, I think the challenge is taking that information into something that's actionable. And we have pretty good data right now on who is more likely to get sick and efforts to direct therapies like monoclonal antibodies to them. I think there's a lot of room for improvement and refinement in that. And items like that I think are going to play into that. I think that's going to happen over the next few weeks or months or so to say as we do it.
Cheap and inexpensive.
Yeah.
Kind of easy to
Yeah. I think those type of things are going to be coming online more. And I mean, look, we still, even though we're able to say on average these type of individuals do very poorly over 70 age of so forth and comorbidities, it's not exclusive. And every day you hear examples of people that don't fit that category that have bad outcomes. And that's humbling. Thank you, everyone.
Thank you, Dr. Cantor. I appreciate your work and the work of everybody at LDH and all of our partners all across the state and our federal partners as well. We may have had our last White House Coronavirus Task Force conference call today with this particular task force at least, and I was able to express that to them. And that brings me to a point I wanted to make. A week from tomorrow, there'll be a new administration in Washington. And so at some point subsequent to that, and I suspect within a few days of the inauguration, we're going to be hearing from the new administration and to determine whether it is going to maintain those changes that were announced today with respect to the federal government not holding back the second dose, but rather shipping that to the states, whether they're going to change the allocation formula going forward to take into consideration the degree to which you are administering the vaccine that you're receiving, or whether they're going to move away from those things or have different changes that they have in mind too. What we know is today there were some things that were announced very different than what we were told to expect. And based on those expectations, we created the plan that we have in place. And that plan certainly includes those priority groups that we've already announced. And so we'll be taking a look at that. And I want to also revisit this idea because I think it's really important for people to understand that if they hear that another state is doing a mass vaccination event, then they think, well, there are more people per capita being vaccinated in that state than we're having here in Louisiana because we're not having those mass events. Well, I will tell you, if you're using the vaccine that you're receiving, you're vaccinating as many people as you can vaccinate. And so then you have to make this determination, and it's especially critical when you don't yet have, just huge amounts of vaccine doses coming in every week. Do you have several large events where people have to travel to try to get vaccinated, or do you push it out like we did this week with 200 different sites administering vaccines in all 64 parishes? And I will tell you, if you're interested in equity and if you want to have the largest possible reach across the state of Louisiana, you do the 210 sites when you're able to do them. That way more people have access to it. It's a much more equitable way to distribute. And at the end of the day, you vaccinated as many people as you could have done at mass events, but those mass events are going to draw people from the areas where you're actually having them. So we look forward to having mass events in addition to what we're doing now when the vaccine allocation supports that. And we are rehearsing for that, we're planning for that, and I want people to know that we hope that day comes sooner rather than later. I will tell you that there are many people working very hard to ensure that shots are getting into arms. And probably the second most important thing to do with respect to the vaccine program is making sure the data is getting put into the links. And that's especially true if Operation Warp Speed is going to factor that into future allocations. It won't be based simply on that, but if it's going to be a factor at all, we absolutely have to do that. And I have talked to all of our major hospitals across the state multiple times about that personally. I know LDH is doing that, and we're also talking to all of these enrolled providers, the pharmacies and others, about making sure that data is put into links just as quickly as possible. And we announced a change last week that we were going to make sure that vaccine does not sit on the shelf any longer than is absolutely necessary. That's how we were able to take this week's allocation plus what we had available to us in those stocks and put 210 sites into operation this week. And that's also going to be our guiding principle going forward, even after the federal government starts sending all of the vaccine and they're not holding back that second shot. But we know we have to be prepared for that second shot to be administered 21 days later if it's Pfizer, 28 days later if it's Moderna. But we don't believe we're going to have to hold back all of the second doses to ensure that we can meet that criteria, but we have to be very deliberate in planning that. And like Dr. Cantor said, the more information we can get from Operation Warp Speed as to the allocation we can expect, not next week, but 3 weeks out, that will give us the comfort that we're going to need to then free up some of those second doses in the meantime to go to first doses, because we'll feel very confident we're going to be able to administer the second doses at the prescribed time intervals. I do want to say a few words about the security concerns that have been raised for the U.S. Capitol and state capitals all over the country, I think all 50 states, for the upcoming time period, I think starting this weekend and going through the inauguration at least. We are aware of that. We're communicating with our federal partners. We're obviously monitoring the situation here. I think we can all be heartened by the fact that we've had demonstrations and protests at the Capitol and elsewhere for many weeks now, all of which have been entirely peaceful, with no lawlessness, no property damage, no violence, and certainly we expect that that will continue. We hope that that will continue, and the First Amendment is critically important. We all should support one another's rights to assemble and to have their voice heard, but obviously it's critically important that they do that in a way that is peaceful, nonviolent, and in accord with the law. We expect that that's what's going to happen here, and we will certainly be monitoring the situation both ahead of time and as these protests and demonstrations happen, to try to make sure that they remain peaceful, and so forth. And I just put a call out to the people of Louisiana who are intending to participate in that. Look, we'll protect your right to do it. But at the same time, we're asking you to make sure that you follow the law. And would remind you that as you gather, you're doing so at a time during a pandemic, and there's no doubt now, but that last week's event at the U.S. Capitol became a super spreader event, and so where you have, even outside, if you have enough people close enough together for long periods of time and they're not wearing masks, that can be a very dangerous environment. So we do encourage people to be mindful of that, and to wear a mask as well. And again, it's been our experience that all of the demonstrations and protests in Louisiana have been entirely peaceful. Having said that, that obviously was not the case in Washington last week. And this past week has been a difficult and dark one for our country. And like I suspect many Louisianans and our fellow Americans, I've spent the last several days reflecting on what happened, and each report, as more information becomes available and they get deeper into the details of what happened there, each report seems to be worse than the previous one. I can tell you, as a veteran, as a governor, as an American, as a Louisianan, I'm both angry and saddened by what we saw. That should never, ever happen in the United States of America. And sometimes we say, I never thought I'd see that. Well, it never occurred to me to even think about this. I mean, it's worse than never thought about it. This is just not what we're supposed to see in the United States of America. And what happened on January 6th is Congress was doing its constitutionally required duty of certifying the election, to have people go in and demand that they not perform that function. That's just unacceptable. And it was violent. They damaged property. It's beyond anything that any of us should ever expect to see in the United States of America. And people in positions of authority, here in Louisiana, across the country, I hope we can commit now to making sure that we're going to do all that we can to put a stop to this, that we're going to be honest with the people that we represent and that we govern, avoid political grandstanding and misleading people to cause them to have the concerns that would rise to the level that they would even feel that this somehow was appropriate. We've lost enough. The pandemic has taken away so much from us. We shouldn't make that worse with continued division and violence. And peaceful demonstrations are certainly a part of free speech. I mentioned that a while ago. Violent demonstrations, lawless demonstrations, those aimed at upsetting, our democracy and undermining our constitutions, those are not. So I guess, y'all have heard me say a lot of times, let's be good neighbors to one another. That's true with respect to COVID. It's also true with respect to being Americans. let's be good Americans as well. So at this time, I'll take a few questions. Sam?
Governor, do you have any insight into, obviously we have thousands of people on waiting lists right now, so it's pretty clear demand is exceeding supply by a lot. So I guess how does the state go about deciding when to move to the next tier of priority groups while keeping demand? Because, we're not above supply, you don't want to fall down like we had over the first couple of weeks. So how do you go about making that decision for moving it to the next group?
Well, what we know is that the demand for those in the current order of priority exceeds the supply to the point where we're not ready to move. And what we're looking at is figuring out a trigger. And one thing that we've discussed is when 80%, when there's an 80% uptake on the available vaccine, meaning that 20% of the appointments are not getting filled, we'll move to the next order of priority. The first time that happens, and that's a rather simple way to do it. And we're looking at all of that now. It's we don't have to make that decision just yet because we're not there, but we're going to have very large populations in these orders of priority. And it's going to take quite some time to get the vaccine to them. But it will not work in the way that some people have envisioned it, where everybody in 1A gets vaccinated before you go to 1B Tier 1, and then everybody in 1B Tier 1 gets it, and you turn them off, and you go to 1B Tier 2. It's not going to be that way, and it was described today, and I think by Secretary Azar on our call, and I think this is a way to help people understand it. It's sort of like loading an airplane. You load by where people sit, but at the same time, you see people who are continuing to load even after their group was called, and that's the way this is going to work. And we're still working through that right now, to be very honest with you. But we'll make sure that there's a relatively seamless way to make those transitions. Yes, sir.
Is there anything specific that the LDH or your administration is looking for, whether it be a certain percentage of the population vaccinated, or anything else that we can move out of phase 2 and on to the next phase?
Yeah, well, we're going to be looking at the gating criteria. And we do that really not just when the current proclamation is about to end. We do that periodically throughout the time period that we're in a given phase. And so we're going to continue to do that, especially as it relates to percent positivity, case growth, hospitalizations. I mean, those are the things that we're going to continue to look at. Obviously, the more people who get vaccinated, especially those who are more vulnerable to the disease, then you can expect that there will be fewer people going into the hospital and fewer people dying. But we are quite a ways from that right now. But what we know, and this is true in many things, not just vaccinations, the quicker we can get vaccinations administered to those groups, based on age and other things that make them especially vulnerable to disease, the quicker we can do that, the quicker we're going to have an impact on those numbers from the vaccination program. But in the meantime, it's incumbent on all of us to have a positive impact on those numbers by wearing our masks and by distancing and washing our hands and staying home when we're sick and engaging in all of those mitigation measures that we've been talking about. Yes, ma'am.
Governor, I know you said you're not ready to make any decisions on the latest CDC guidance, but do you see, you've already announced what the next group is, phase 1B, tier 2, whatever.
Correct. You got it.
Do you see a possibility of tweaking that list of who's included in that group before moving to it now that the CDC has issued guidance? And is there a possibility you could tweak the rules of those who are currently eligible in that tier 1?
Yeah, because we just found out about this today and we haven't made the decisions. Everything that you just mentioned is possible because we haven't decided what we're going to do. with respect to these new recommendations. It would probably, and this is me thinking out loud, and Dr. Cantor's saying, please don't do that. It would be more likely that we would adjust what is in Phase 1B Tier 2 rather than adjust what we are currently doing, because we have a group out there that we have promised they are the priority right now, and we haven't come close to having the supply necessary to get them all vaccinated. And so when we move to the next group, that group may look a little different, a little larger than it currently does based on the recommendations that we got today. And look, I know this is it may not seem like a big thing to a lot of members in the public, but we based our plan on the CDC guidance and the ACIP recommendations that we got weeks ago. And they changed that plan today. I mean, this is not a minor, insubstantial change, because I don't believe that the ACIP ever contemplated that people below 75, we went to 70 in Louisiana, but below 75 would be prioritized as a group before people of certain occupations. And now they've come in and they've added 10 years worth of people, those 65 to 74, where they wasn't in the previous recommendation at all. And so we have to look at that in Louisiana. It will be less of an impact here because we already went down to 70. But there's a lot of work to be done, and we've only had this new guidance for the last couple of hours. And so I suspect we're not going to be making a change right away. And one of the things that I'm most interested in seeing is, what is the new recommendation going to be, or I'm sorry, what is the new administration going to do with respect to these very same recommendations? Will it stand by those or not, and so forth. So we're working on it. I can assure you we're working on it. Andre?
Governor, how is the ad campaign working to try to encourage people to make sure that they're not afraid of getting a shot in the arm, getting
Yeah.
vaccinated? I know that there is a problem, according to a lot of nursing homes, with nursing home staff wanting to be vaccinated, where the patients are eager.
Yeah.
They're probably door for it.
Obviously, the vaccine hesitancy remains more pronounced than we would want it to be, but it is less pronounced than it was a month ago and 2 months ago for sure. One of the things that Secretary Azar commented on today is that through polling and other information that they have available, hesitancy across the country is diminishing over time. And it principally happens when you see someone in your family or a colleague, especially if they look like you, they get vaccinated, they don't have a severe reaction, and you know, they seem to be well, then all of a sudden you're much more interested in getting it. That seems to be happening across Louisiana today. I don't want to kid anybody. There's still more people than I would like to see who are declining to be vaccinated when it's available to them. And hopefully they will come to believe, as I do, that it is safe and effective. But more than that, it is safe and effective, and it is the only way to put this pandemic behind us. And that hesitancy also is more pronounced in certain demographics as well. And so we need people, and you talked about an ad campaign. We do need to make sure that there are folks out there promoting the safety and efficacy of the vaccine who look like the people that are going to be taking it. So they can't all look like me, right? We have to do that, and I think that is happening across the state. It's also happening across the country, and I'm never going to tell you that communication is as good as it should be or will be, but I am optimistic that at the end of the day, enough people are going to be vaccinated that we can put this pandemic behind us. Yes, sir.
From where we stand right now, is there any, is it safe to say that Mardi Gras in any way, shape, or form for this year is going to be canceled?
Well, you know, I know that the mayor of New Orleans made an announcement a long time ago that there wouldn't be the large events associated with Mardi Gras. Now, that was only good for Orleans Parish, I will tell you that anybody who thinks Mardi Gras this year should in any way resemble what we typically do is making a tremendous mistake, much like individuals did with how they traveled and gathered for the holidays. I mean, you just can't, with the degree of community spread that we have and the number of people in our hospitals right now, the idea that we would have large celebrations like a Mardi Gras ball, like a Mardi Gras parade, just absolutely irresponsible. And so it's not consistent with the current mitigation measures and with the restrictions that we have in place here. I know it's not in New Orleans as well. So there are some folks who are spending a lot of time trying to figure out how we can preserve as much of our unique traditions and so forth as we can, but do it safely. I think they're looking at a lot of virtual events and other things that could take place so that we don't go without Mardi Gras this year. But we're going to, had a piece of king cake yesterday, by the way, and I know that's a small thing, but there are certain things that we can do. Maybe we shouldn't, like the king cake, but we can do those and preserve as much of that Mardi Gras tradition as possible until we can have the normal celebrations, which hopefully will be next year. Yes, sir.
Hey, Governor, so how much of a factor is the COVID variant, the new variant?
Yep.
How much you guys keep in mind?
Well, we don't know. I don't know that we have confirmed the presence of the new variant in Louisiana through genetic sequencing of the virus. I would tell you we should all assume that it's here. I can tell you it certainly appears to me that the virus is transmitting more easily, more quickly, and it could just be a function of how much more there is in the community, or it could be that plus the fact that we have a new variant of it that is more easily transmitted. But it doesn't make any difference as far as what we should be doing right now. It is the mitigation. It's the wearing the mask, the washing the hands, the physical distancing, staying home when you're sick. Those are the things that we have to do, regardless of whether we have it or not. And, that's really what viruses do over time. They always mutate, and quite often it's in a way that makes it more transmissible. And so if that's been detected elsewhere, we should assume that it's happening here. I mean, and quite frankly, in the United States of America, we're not taking enough samples of the virus and doing the genetic sequencing on it like other countries are to always know, have a good handle on when we have a new variant. But we just don't know. We should assume it. I can tell you I received a communication last week from someone on the White House Coronavirus Task Force who floated the possibility. Dr. Burke certainly didn't say that she knew for a fact, but it was a working theory that they had, is that there is at least a new variant that is working its way across the country, and that we should expect that it's present. Not that it really changes anything other than perhaps make it a little more urgent that we all do the things that we've been talking about doing all along. You have a follow up on that?
What kind of testing is the state doing to see if variants do?
Well, I'll let Dr. Cantor answer this. One thing I can tell you is the CDC itself is testing twice as many samples now as they were just several weeks ago. And when I say testing, doing the genetic sequencing to see whether there is a new variant at play. In the state of Louisiana, there is a little bit of this going on. I know that we're asking Tulane to do more genetic sequencing so that we have an entity in state that's taking a look at this, and I don't know if we've gotten a report back from them.
It's negative.
Yeah.
We haven't had a positive yet.
So of the samples that they have been sequencing, they have not detected a new variant in Louisiana. Again, I don't take that to mean that it isn't present in Louisiana. We just haven't scientifically tested the new variant to be present. Yes, sir.
Governor, the feds are sending down, I think, $3 billion to states for vaccine distribution. Do you know what our share of that money is going to be
Yeah, so if memory serves me, we have $247 million coming for testing and around 28 million for 42, and it's been a while since I looked at that number. But what I was struck by is how much additional funding we got for testing as opposed to vaccine allocation. And Dr. Cantor, and I'll get you the more precise figure shortly, but I think it's going to be around $40 million or so, whereas we're getting well over $200 million for additional funding related to testing, all of which is really important. And we do believe that there will be additional packages coming from Congress. The new administration has said as such, and whether they include additional money for the vaccine distribution and administration remains to be seen, but I know that they have indicated that they would like to do that. But those are the funds that I'm
And are you spending the vaccine money on like staff? Like what is the money going to be used for here in terms of the vaccine, the 40 million or whatever?
Well, there's cost associated with everything that we're doing with respect to the vaccine, and I can get you a better handle on where we anticipate those dollars flowing, and in fact, I don't think the dollars are even here yet. We've started the vaccine program, so a lot of them will go to reimburse things that we've already expended money on. We've been paying for this for a while. And then as you ramp up and you hopefully get ever increasing allocations, then the costs actually increase. So that if you do these mass events in addition, mass vaccination events in addition to the fixed sites that you have all around the state, there's costs associated with all of that. I can tell you that one of the things that we're concerned about from a cost perspective relates to one of the changes that was announced today. So if the federal government, if Operation Warp Speed stops holding the second dose and sends it all to us and we have to hold it, then we're going to have to pay for that to happen, and for it to then be distributed on order to the various sites so that it can be administered. Whereas if Operation Warp Speed held it itself and we ordered it, they would pay for the cost of distributing directly to that enrolled provider who's going to administer that second injection. So the change they talked about today is going to be much more costly for the states. We don't know how much more costly yet, but we know it's going to involve more costs. Any other questions? Andre, you got one? Okay. Look, thank you all very much for continuing to cover this. It's sort of hard to deliver two messages at the same time and have them both received the way you want to. There is a light at the end of the tunnel. This vaccination effort is incredibly important. It's what's going to eventually allow us to put this pandemic behind us, return to normalcy, I pray before the end of 2021. And we should start getting much better much sooner than that. But the next several weeks are going to be incredibly tough. Dr. Redfield of the CDC today said on the White House Coronavirus Task Force call that the next 4 to 6 weeks will be the worst that we have experienced as a country. And quite frankly, there's not a lot we can do about that today to make those weeks any better. But if we want to limit it to 4 to 6 weeks and then see a leveling off and get better, then we all have things that we have to do starting today. And those are the things we've been talking about all along. And I know people are tired of hearing it. I know many people are tired of doing these things. But this is the challenge that we've been given. This is our moment. And either we're going to do it or we're not. And if we don't do it, needless of our brothers and sisters across the state, across the country, are going to die. They're going to be hospitalized. We're going to continue to tax our healthcare delivery system. It's going to continue to cause people to be in poorer health than they otherwise would be, not just because of COVID, but for any condition that requires hospitalization. So I urge everybody to get the vaccine when you are able. Understand that it is safe and effective, and it is the only way we're going to get past this pandemic. But also to understand that we have to keep wearing our mask and distancing and washing our hands and staying home when we're sick. Critically important. And I do want to prepare everybody for the next several weeks. They're just not going to be pretty. Will be the hardest weeks that we've had since the pandemic hit. But we do have it within our control to make sure that it's just a few weeks and that we get better after that. And I have every confidence that the people of Louisiana will do that. So thank you all very much. Our next press conference will be scheduled for next week. And we'll let you know next week when that's going to be. And thank you all for changing your schedule and coming over here today. It was important for us to be able to have a video telephone conference with the White House Task Force, and we do that from here because this is where the technology is best for that. And so we just stayed here for the press conference. I don't know whether next week's press conference will be here or back over at the Capitol, but we'll let you know then. Thank you so much, and God bless.